Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Maternal infection during pregnancy linked with childhood leukemia among offspring finds study. Maternal genitourinary tract infection during pregnancy was associated with childhood leukemia among offspring, suggests findings from a Danish cohort study published recently in JAMA Network Open. Maternal infection is common during pregnancy and is an important potential cause of fetal genetic and immunological abnormalities. Maternal infection has been reported to be associated with childhood leukemia in previous case control or small cohort studies. The study, conducted by Jian Rong-hee et al., aimed to evaluate the association of maternal infection during pregnancy with childhood leukemia among offspring in a large study. They used data from 7 Danish national registries for all live births in Denmark between 1978 and 2015. Swedish registry data for all live births between 1988 and 2014 were used to validate the findings for the Danish cohort. Data were analyzed from December 2019 to December 2021. The primary outcome was any leukemia. Secondary outcomes were acute lymphoid leukemia, that is ALL, and acute myeloid leukemia, that is AML. Severe form of mpox with high mortality seen in people with advanced HIV finds study. An international collaboration of clinicians published the largest case series of mpox infection in people with advanced HIV disease in The Lancet, in which they identify a new severe form of mpox. The majority of mpox infections in the current multi-country outbreak have occurred in sexual networks of gay, bisexual, and other men who have sex with men. The ShareNet clinicians looked at 382 people with advanced HIV disease and mpox, including 27 of the 60 people reported to have died of mpox during the multi-country outbreak. The group describes a very severe form of mpox characterized by widespread, large, necrotizing skin lesions, high rates of severe infections, and in some cases, unusual lung lesions. This form of the disease carries a 15% mortality in people with advanced HIV disease and immunosuppression. All 27 deaths occurred within this group. Physical activity intervention at schools can help prevent childhood obesity, finds study. A new Slovenian population-scale school-based study shows that by providing additional physical education lessons to young children is effective in preventing childhood obesity, according to findings published in Obesity Journal. The present study leverages a natural experiment that provided the opportunity to examine the effectiveness of healthy lifestyle, a real-world population-based longitudinal physical activity intervention on body mass index in children aged 6 to 14 years. Shedding light on best medications for treating acute low back pain. You might have had at least one backache in your life so far. Although this pain may happen in any part of your back, the most common area affected is your lower back, and it's because the lower back supports most of your body weight. You will usually first feel back pain just after you move suddenly, lift a heavy object, sit in the same position for a long time, or have an injury. The pain may be caused by muscle spasms or a strain or tear in the muscles and ligaments. Acute low back pain is a common cause of disability. An analysis in the Journal of Orthopedic Research examined which non-opioid drugs are best for treating this condition. The analysis, which included all randomized controlled trials published to date, which is 18 studies with 3,478 patients, showed that muscle relaxants and non-steroidal anti-inflammatory drugs, or NSAIDs, could effectively and rapidly reduce symptoms. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.